hold this for a second. Okay, hi Gustavo, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment. This is the inside part of the knee. And we're just going to start our look around and see these pieces as we come across them. Right now we're just looking at the meniscus. And this meniscus looks like it's in good shape, which is what we expected. You can see a lot of the redness in the joint capsule. That's because of this ongoing irritation from these loose pieces. We're going to look in the central part of the knee. I may have to remove a little bit of tissue called the ligamentum here in just a minute. We'll have a look. Okay, so there's the anterior cruciate ligament running up. Posterior cruciate ligaments behind that. And at least in this front part of the knee, we haven't really seen any loose pieces yet. And the cartilage surfaces here look pretty good. Grab that knee and straighten it out slowly. Okay, that's great. Yeah, so the cartilage on the femoral condyle in this medial compartment looks good. You can let it go. So we're going to look next in the lateral compartment. Pause. Okay, so this is the lateral compartment. The posterior hornus lateral meniscus looks pretty good. Here's the body of the lateral meniscus. There's the popliteus tendon running up towards 11 o'clock on the screen. And then again, we see a lot of redness in the joint lining that goes along with having these loose pieces causing inflammation. But again, we still haven't seen any significant loose pieces yet. Okay, we'll keep looking here, show you some more a little bit. Okay, recording. Okay, so now we're looking at the patellofemoal joint. Table up, please. Table up just a little bit, please. Keep going. Okay, so now we're looking at the patellofemoal joint. You can see some cartilage hanging down here. This is coming off of the patella, it looks like, off the medial. Keep the knee rolled like that. Coming off the medial facet of the patella. Go ahead and throw a tourniquet up, please. And these loose pieces of cartilage are what are getting stuck in the joint. Right here, I'm going to remove this because this isn't something that's repairable and is only something that can cause a problem once it becomes an actual loose piece. You can see that right there. Okay. Now we're expecting to find multiple other loose pieces now that we're up here in the patellofemoral area. There's another big piece there you see. There's a bunch of them there, so I just want to show you them all. We're going to take them all out, but you can get a good idea of how much work we have to do here. So we'll slowly get to work and start taking these out one at a time, okay? Pause. To 75 just for a minute. Okay, so this is the defect or the lesion in the trochlea. This is the medial aspect of the trochlea. Let me just rotate around and orient everyone. So there's the patella at the top of the screen. That's lateral to the left, medial to the right. The trochlear defect's at the top. And then we have this kissing lesion. I'm sorry, the patellar defect's at the top, and then we have this kissing lesion in the trochlea down here. This allows us to measure. That line is a centimeter. Half centimeter from long line to long line. So that is 1 centimeter from here to here, looks like just about. And going this way, if I was going to estimate, it's about 1.5 centimeters this way. But it's not contained. You can see it runs all the way up to the top of the trochlea here. Okay, there's a little bit of a shoulder here where it's contained. Okay, pause for a second. Got it. Okay, so I'm looking here down the medial gutter, and I don't see any more loose pieces here. So that's good. We'll slowly pull back. We'll get into the suprapatellar recess or pouch up here. We'll pull back. At the top of the screen, you can see that defect in the patella here. I've changed positions. The scope's on the lateral on the medial side. So now you can get a pretty good look of the extent of that patellar problem we've got. As far as loose pieces, we've taken out 3 big pieces already. I don't see anything else floating around up here. We're going to go back to the lateral gutter. And we'll use this just to help us retract and see. So there's nothing else down here. There was before. And as we get all the way down close to the joint line, which is all the way down here, it looks like we've got all these loose pieces out. Hold this right here just like that. Keep pushing that way. And we're just irrigating a bunch, and I don't see any more loose pieces there to worry about. So that's good. So now I'm going to put the shaver back in laterally here. We'll show you some more in a little bit. Okay, so now we're getting a really good look at this trochlear defect. There is 5 millimeters there, medial to lateral, and then just estimating this distance is going to be about 1 centimeter. Okay, so that's what we've got there. I think that's enough of a look to make some plans. And now we're going to look up at the patella and try and do a similar evaluation here. I don't think there's any more loose pieces to worry about. And in terms of measurements, it looks like we're at about 1 centimeter of cartilage. It's not great there. And maybe 5 millimeters in the other direction. So that gives us an idea of what we have to try and do for you to try and solve this problem going forward. But at least we've got the loose bodies out. At least I think we've got this cartilage back to stable margins right now. I just don't want to leave anything that's about to become loose.